The lungs, bronchi, trachea, and other airways are all susceptible to a variety of disorders that collectively make up the respiratory system. Depending on the severity of the sickness, these conditions can drastically reduce a person's standard of living. The air we breathe, cigarette smokes, viruses, allergies, and even our genes can all play a role in their development. Learn about the signs, symptoms, causes, and the way to avoid several common respiratory disorders with this comprehensive video. Acquiring knowledge about respiratory illness. Breathing is made possible by the respiratory system, which also supplies the body with oxygen. Vital organs that oxygenate blood are the lungs, which are part of the system. The airway that carries air to the lungs tube is called the bronchial tube. The windpipe that carries air from the nasal passes the oral cavity to lungs is called the trachea. The diaphragm is a muscle that help with breathing by allowing the lungs to contract and expand. Symptoms including shortness of breath, chest pain, coughing, and generalized exhaustion can develop when the respiratory system is compromised. We will go over the most prevalent respiratory illness. Classification of respiratory illness. First one is asthma. Synopsis. In asthma, the airways are irritated and narrowed over time, which makes breathing difficult. Things in the environment or allergens can set it off. Root causes: dust mites, mold, pollen, smoking, and animal danger are allergic asthma triggers. Exercising, being under stress, or being cold can all amplify symptoms. Sign and symptoms: coughing of mucus, wheezing, chest tightness, and difficulty breathing are common signs and symptoms. Treatment. While there is currently no cure for asthma, it can be controlled with medicine such as inhalers, behavioral modifications, and avoiding things that trigger attacks. Second one is COPD or chronic obstructive pulmonary disease. COPD is a chronic inflammatory disorder that worsens with time and causes airflow obstruction in the lungs. Chronic bronchitis and emphysema are the two primary diseases that fall under the umbrella. What causes chronic obstructive pulmonary disease? Smoking, of course, but environmental toxins and occupational dust are also factors. Signs and symptoms: difficulty breathing, a persistent cough that produces mucus, recurrent respiratory infections, and extreme exhaustion. Medication: bronchodilators, steroids, lifestyle changes, and in severe instances, oxygen therapy are all part of the treatment plan. Third one is bronchitis. General information. Inflammation of the bronchial tube, which leads air to the lungs, is known as bronchitis. This can have a short-term or long-term duration. Infection with viruses or bacteria are common causes of acute bronchitis, whereas smoking and long-term exposure to pollutant are the most common cause of chronic bronchitis. Difficulty breathing, wheezing, mucus production, and the persistent cough. For the treatment, getting plenty of sleep, drinking enough of water, and in severe cases, antibiotics to kill any bacteria. Bronchodilators and behavioral modification are suggested for long-term instances. Fourth one is pneumonia. Pneumonia is an infection that can cause inflammation of the air sacs in the lungs. If left untreated, the sacs can fill up with fluid or pus. The most frequent bacterium that can cause this condition is Streptococcus pneumoniae. However, viruses such as influenza and fungi can also play a role. Sign: chest pain, fast breathing, high temperature, chills, and a cough that produces phlegm are symptoms. Treatment: prophylactic antibiotics against bacteria, antiviral against viruses, and supportive care are all part of management plan for pneumonia. Some form of pneumonia can also be prevented with vaccination. Fifth one is lung cancer. Overview: tumor arising from uncontrolled growth of aberrant cells in the lungs constitute lung cancer. On a global scale, it ranks high among cancer killers. Smoking is the leading cause of lung cancer. However, environmental toxin, genetic predisposition, and secondhand smoke can also cause the disease in non-smokers. Signs and symptoms include a persistent cough, blood in the mucus, unexplained loss of weight, difficulty breathing, and chest discomfort. Care: surgical excision, chemo, radiation, and targeted medication therapy are all viable treatment choices. Finding issues early on greatly enhances the quality of treatment. Tuberculosis, TB. General information: Mycobacterium tuberculosis germs cause tuberculosis, an infectious disease that mostly affects the lungs but can spread to other organs. Reasons: when a person with tuberculosis coughs or sneezes, the virus is able to spread through the airborne droplets. Fatigue, weight loss, night sweats, fever, and persistent cough are some of the symptoms. Treatment of tuberculosis typically involves a lengthy regimen of medication. Controlling its spread requires prompt treatment and vaccination. Method for avoiding respiratory illness: the key to lowering the risk of respiratory disorder is prevention. Here are a few practical steps. First, don't light up. Tobacco use is directly linked to a host of respiratory illness, to lessen one's chances of developing chronic obstructive pulmonary disease (COPD) and lung cancer. One should quit smoking and stay away from those who smoke. Second, reducing pollutant exposure. A mask in polluted places, an air purifier at home, and less exposure to harmful chemicals, fumes, and dust can all contribute to a healthy respiratory system. Third one, get some exercise on a regular basis. Doing so will help your lungs and respiratory system work better. Lung capacity can be improved through aerobic exercise such as swimming, cycling, and walking. Fourth one, practice good hygiene. To reduce the risk of respiratory diseases such as bronchitis, pneumonia, and tuberculosis, it is recommended to regularly wash hands, use hand sanitizers, and stay away from ill people. Fifth one is immunization. Vaccines help protect against certain respiratory infections such as influenza and pneumonia. This is particularly true for vulnerable populations like children and elderly, and those with impaired immune system. Sixth one, eat well. Maintaining healthy respiratory function is possible with a well-balanced diet that is high in antioxidant, omega-3, fatty acid, vitamin C, and vitamin E. To keep your lungs healthy, eat plenty of citrus fruits, vegetables, nuts, and fatty fish. Seventh one is keep stress at bay. Respiratory health can be adversely affected by chronic stress. Mindfulness, meditation, and relaxation practices can aid in stress management, and immune system support. In summary, we can say millions of people around the world suffer from respiratory illness, which have a negative effect on their health and quality of life. People can take charge for their health and reduce their risk of respiratory disease by learning about them and being familiar with their symptoms, types, and causes. Reducing the chance of acquiring respiratory disorder is possible by chance changes in lifestyle, preventative treatment, and avoiding harmful exposures. Go medical help right away if you notice any symptom so you can go on the road to recovery. A healthy respiratory system is a key component of a healthy body, and there are simple things you can do now to safeguard your health for tomorrow.